Regenerative medicine is one of the most innovative areas of advanced aesthetic practice. Its goal is to restore the function and structure of damaged tissues using stem cells, growth factors, and other biological therapies. In aesthetic medicine, it is used to address volume loss, sagging, photoaging, androgenetic or scarring alopecia, and certain post-surgical or traumatic sequelae. The most widespread therapies include the use of platelet-rich plasma, PRP, and mesenchymal stem cells derived from tissues such as adipose tissue or bone marrow. PRP is an autologous platelet concentrate obtained by centrifuging the patient's own blood. It contains growth factors such as PDGF, TGF-beta, VEGF, IGF-1, EGF, and FGF, which stimulate angiogenesis, cell migration, and collagen, and extracellular matrix synthesis. It is applied through micropunctures in the superficial dermis or by direct infiltration into areas affected by atrophy or sagging. It is particularly useful in facial rejuvenation, treatment of dark circles, atrophic scars, and hair loss. Its safety is high since it is an autologous derivative, although it requires aseptic preparation and standardized protocols. The use of PRP in aesthetics is regulated in Spain as a human use drug by AEMPS. This involves requirements such as medical prescription, quality control, pharmacovigilance, and informed consent. It is contraindicated in patients with thrombocytopenia, active infections, sepsis, or recent anticoagulant treatment. Additionally, its effectiveness may be reduced if the patient has taken non-steroidal anti-inflammatory drugs before the procedure. The professional must master the technique of extraction, activation, and application to ensure homogeneous and reproducible results. Regenerative medicine requires continuous training, clinical judgment, and absolute respect for bioethics and patient safety.